Okay. Have you done any research or anything like that on
I
liposuction?
have.
Okay, so you know a
Yes.
little bit about it.
Mhm.
Have you had any procedures in the past?
Yes, I had breast reduction.
Breast reduction. Okay.
Mhm.
But no liposuction or
No,
anything of
no.
that nature.
Mm-mm.
Okay. So what we do here is a procedure by the name of Tumescent liposuction.
Okay.
So it is just slightly different than your traditional liposuction in a couple of different ways. One being general anesthesia. That's the biggest one. The general anesthesia is where most of your complications can occur.
Okay.
So we do not use general anesthesia. That's what makes our procedure so safe and actually allows us to do it here in this office. So what we do is we use a local anesthetic, a solution of lidocaine and saline that we actually instill into whatever area we are removing fat. So during this procedure, you are awake and alert during the whole procedure.
Yeah.
So that obviously it's safer that way, but it also allows me to use that to my advantage. I'm able to manipulate you, turn you on your sides, turn you on your back, stand you up, do all kinds of things to really sculpt you out. And that's another big thing that we really take pride in here at this clinic is the sculpturing piece.
Gotcha.
Because you can remove fat, it's simple enough, but to sculpt patients is in a lot of ways an art. And so I use the fact that you are awake and alert to my advantage to come in from different angles, stand you up, see how gravity reacts to the fat once the fat's removed.
Okay.
Because as you would imagine, if you're on your back, I'm sucking out the fat and then I'm done, and then you go home and you stand up, gravity takes forward, and then things shift and they look different.
Right.
So we try to use the fact that I can stand you up, turn you on your sides, all of that to my advantage in sculpturing you.
Okay.
The procedure takes anywhere from about 2 to 3 hours typically. Probably the first couple of weeks you're pretty sore. It's like a real hard workout. So you're sore, but it's doable. And as time kind of progresses, that soreness dissipates. The other big advantage of the Tumescent procedure is downtime between the traditional. I mean, traditional, they say downtime is anywhere from 1 to 2 weeks. Ours is more 1 to 2 days. Most people are back to work in 2 or 3 days. Now, again, you're sore, but you're functional.
Right.
So a lot of our patients do very well. We do the procedure and they're back to work the next few days. We do use some medications to help relax you. So we use kind of an anxiety medication, a pain medication. We ask you that you bring the medications to the procedure just in case we need to dose again. We also use a intramuscular injection which helps relax you as well during the procedure. So 99.9% of my patients are able to tolerate the procedure.
Okay.
And I'm looking. Do you have any tattoos?
No, just here on my back.
Well, that's kind of my litmus test. Most patients who can handle tattoos do fine with this.
Oh, well, I really couldn't handle what I was getting in, but I made it through.
That's the best thing I can kind of compare it with.
Yeah.
Because it's like no other sensation, just because you haven't experienced anything like this.
Yeah.
And so what I tend to do is I make some small incisions. So if I'm doing an abdomen, I make small incisions right at the panty line and then one right at the belly button.
Okay.
And I purposely do the incisions there to kind of conceal, just in case, they either are hyperpigmented or something of that nature. They're very well hidden.
Okay.
The belly button one looks like a belly button ring, basically. But I make those small incisions. They're no larger than an eraser head, and that's how I introduce my instruments.
Okay.
So, do you have any questions?
What are the risks?
Okay. So the risk with liposuction, the main risk, that you really see with this procedure, one is of bleeding and the other is infection. Those are probably the top 2 risks that I see with liposuction.
Okay.
So during the procedure, actually, I use a antibiotic during my pre-op and post-op procedure. that is actually not recommended because most of these incisions and most of the procedures, they have found that it's really not necessary to use antibiotics because there's such a low risk of infection. But I do it as more of a precautionary measure.
Okay.
So I do add an antibiotic, which further reduces your risk of infection. The other bleeding, when I'm in that tissue, I'm in a space where there is fat tissue. It's right below the epidermis, or the skin layer. In that space, there's very few blood vessels. There's no major blood vessels, just more blood vessel tips. So I do injure some of those vessels as I'm pulling out the fat. So on occasion, you do see some blood tinged in the fat that I pull out. But the blood loss is minimal as well because we just don't hit any kind of major vessels.
Okay.
But those really are probably your more common risk in this procedure.
Okay.
Anything else?
No, I think I pretty much got a lot of information.
Yeah, Cherie's really good.
So,
You can
yes.
cut that out. I don't want that to be on the tape, that you're very good.
I got it. You want me to cut it